Hi, Kevin Henry, the Group Editorial Director for Advanstar and Dental Products Report, and I'm on a Google Hangout today with Dr. James Stein. Dr. Stein, would you take just a moment to kind of introduce yourself to our viewers?
Yes, as you know, my name is James Stein, and I'm a prosthodontist. I practice in Boston, Massachusetts, and I've been involved in CAD/CAM technology for 6 years.
And Dr. Stein, I know you have a role coming up in the AAP meeting, and I was wondering if you could just kind of tell our viewers what you'll be doing in conjunction with that.
I'm really excited about that myself, and Simon Bernstein, who's a periodontist in the Boston area, we're participating in the corporate forum on the CAMLOT program for Henry Schein. And we're real excited because we're going to talk a lot about the communication that is necessary when using CAD/CAM technology, both for the surgeon and the restorative dentist.
And that's a perfect segue into my first question for you. Could you kind of give our viewers some of the tips that you'll be talking about regarding that CAD/CAM and the communication between the surgeon and the general dentist?
Sure. Our focus is really going to be on the area of dental implants. And because Simon is a surgeon who is using digital impression technology, he has the advantage of communicating with me as the restorative dentist in a way that most non-technologically advanced dentists don't have. And we're able to share communication at both the planning stage and the treatment stage through scanning dental implants with digitally coded scan bodies, and as I said, also in manufacturing milled guides, and as well as sophisticated prostheses for these patients.
And tell me how having that kind of technology available to you has really changed things for not only your patients, but your practice as well.
Well, for me, as a restorative dentist, it's been invaluable because once I got involved in making my own single-visit CAD/CAM restorations with the PlanMecca PlanScan system, I was able to reduce patient visits, chair time, and also treatment time for these patients, as well as now place implants in a much more accurate and sophisticated way with the digital planning using the Romexa software.
And let's talk a little bit about those implant procedures. I know that obviously you feel the technology really helps you simplify that. What are some other things that you would offer to our viewers as kind of ways to simplify the implant process?
Well, I think having the advantage of taking a digital impression preoperatively and combining that with the CAT scan DICOM data in many instances allows us to develop a surgical guide where we don't have to lay a surgical flap, and therefore the procedures are much less traumatic for the patients. Also, when doing that technique, there are many times where then we can place scan bodies, get the position of the implant scanned at the time of surgery, and then 4 to 6 months later have the restorations ready for the patient. So there's much less trauma for the patient, much less morbidity. Most of these patients just tell us they take 2 Advil and that's really all they need. And I think also in terms of internal marketing, they perceive us as technologically evolved and not as Luddites.
It's funny you say that because that was going to be my next question to you. Is obviously this has to be great for your patients to go out there and then tell their friends about, you know, what might have been a worrisome procedure in their head heading in, and obviously it wasn't that case at all heading out, right?
Exactly. I mean, you just summed up what I would say for you. But the fact that patients don't have pain, many times don't have any sutures, and that the whole procedure of having 1 or 2 implants placed is taking under an hour really makes the experience a lot more tolerable for them.
I know I've heard it said by several practitioners that placing implants with this kind of technology should be the standard of care now and definitely will be in the future. Would you agree with that statement?
Well, I would agree wholeheartedly, and truthfully, it's hard for me to understand why dentistry's been so slow to incorporate this technology. I know that you have to change the way you've done things, and that's hard for dentists, and I know you have to invest in equipment, and that's tough too. But the fact that you can place implants and restore implants in a way that's so much more predictable and elegant seems to me seems to me to be worth the cost, learning new skills, and getting over the fear.
So, Dr. Stein, as we wrap up, any final thoughts or anything else that you'd like to leave with our viewers?
Yes, I think that the value of this program that Dr. Bernstein and I will be doing at the AAP is that it'll show dentists a seamless and easy way to communicate using this digital CAD/CAM technology and the benefits to their practice and the benefits to their patients.
Well, Dr. Stein, thank you so much for your time today. I really appreciate it, and obviously best of luck to you at the AAP meeting coming up.
Thank you, Kevin. Enjoy.